Welcome back to the Holistic Health Bites podcast. Today, we're going to have a conversation around breast cancer diagnoses and how to get through the whole journey if you get the diagnosis personally or if someone in your life does, and how you can handle getting through the scary news and all the details that go along with getting a diagnosis like breast cancer. And I am joined today by Lourie, who's going to share her perspective on how this whole process should go and how to get through it with the least amount of overwhelm and just confusion from all the things. So welcome. Thank you so much for joining.
Thank you so much for having me. I'm very happy to be here to present this really important information to your audience.
Yeah, absolutely. So will you just kind of give everyone a little quick introduction to yourself and how you got into focusing on breast cancer?
Sure. I graduated from the National College of Naturopathic Medicine in Portland, Oregon, many years ago. And then I moved to California and I got my acupuncture license. And I've always been a homeopath. And I had a very successful practice in Berkeley, California. And then one day I got a phone call. I thought it was a crank call. It turned out to be a dear friend, and she was hysterically crying, saying the 4 words no woman wants to hear. They found a lump. And that was the beginning of my saying to her, you're not going to go through this journey alone. 18 months of attending every appointment, a UCSF, biopsy, radiation, chemotherapy, lumpectomy. And I was there with her. And then afterwards, I took care of her using my skills as a naturopathic doctor and an acupuncturist. And one day we were in UCSF with her oncologist, and she looked at the blood work and looked back at us and said, "What are you doing?" And I was alarmed. I thought maybe there's a problem. And I went through some of the things I was doing. And she said, "Well, I don't know what you're doing, but I want all my patients to be doing this too, because this is not the blood work of somebody who is in the middle of chemotherapy."
Wow.
So that was, she started referring all of her patients to me, and that was the beginning of my practice, focusing exclusively on breast cancer. And the need, unfortunately, eclipses what I can handle in my office. And I developed an online live coaching program to provide women with the skills that they need to get through treatment and then recover their health and restore their life afterwards, especially when they've been placed on hormonal blocking therapies, which is not easy to get through.
Yeah, there's a lot of problems and side effects with all of these medications, from the treatments and then the after, medications that do all their various things, including blocking the hormones. There's just so many benefits that those drugs are providing, but also there's a lot of side effects and problems and other health issues that they can introduce. So definitely want to dive a little bit more into that. But I would love to just kind of talk a little bit about the cancer process, the cancer treatment, kind of where things are today for people who maybe haven't gone through this journey recently or with someone recently. What is the state of, from diagnosis to those initial stages of treatment? What does that look like? And what do people need to know if they are to get that awful news?
Well, I think it's important to realize that only 10 to 15% of breast cancer is genetic. So that means the rest of those percentages, 85, 90%, are within your control. And that is where lifestyle management, eating healthy, watching the saturated fat, detoxing your home, not having the plug-ins or spraying your furniture or dryer sheets or using over-the-counter laundry detergent, what you put on your body, perfumes, all of that toxic load contributes to inflammation. And inflammation is the breeding ground, so to speak, for any chronic metabolic disease, which is what breast cancer is. It's a chronic metabolic disease. And that means pathways, which usually are healthy, have somehow gotten on an unhealthy freeway. So and I talk to hundreds of women a month with breast cancer, and I always say, was this discovered on a routine mammogram, or did you feel a lump? And I'd say 80% say routine mammogram. So there's a lot of mixed messaging about mammograms are not so healthy. They give radiation and all of that. And there is something called the QT scan, but until that becomes standard of care, and they have those machines everywhere throughout the US, mammograms are your best bet for discovering something. And sometimes if you have dense breasts, then it's not even discovered on a mammogram. You need an ultrasound and sometimes an MRI. So listen to your intuition. If you feel something is not right in your body and they say, well, we don't see anything on a mammogram, you have the legal right to say, this doesn't feel right. I need an ultrasound. I need an MRI. And you can insist. So early diagnosis is the best bet. Now, after the diagnosis, all of a sudden, you're on the wheel of you need to have a biopsy, you're generated a pathology report, then you meet with the oncologist. Sometimes something called neoadjuvant chemotherapy is ordered, which is chemotherapy before you have surgery. Sometimes a mastectomy is recommended. And my recommendation is before you have any surgery, you have the legal right to ask for a second opinion, because there is mixed research about the benefit versus the not benefit of having mastectomies. So you need to make sure if that is going to happen, that that is really medically indicated and not something that you can avoid. Then you go through chemotherapy and radiation. In some ways, as an integrative practitioner, it's easier to recover from chemo than it is radiation. Now, medical oncology, their area of expertise is to address the tumor, which is very important. My area of expertise is to take care of the woman during and after, to make sure that you are as healthy as possible. I know that sounds like a very strange, how can I be healthy when I'm in the middle of treatment? But you can be as healthy as possible during treatment, and that can ensure a higher level of success of treatment. And then we want to work immediately afterwards to help you detoxify from treatment, restore the health of your gut, which has been compromised by all the treatments. And then comes the new chapter of being placed on tamoxifen or an aromatase inhibitor.
Okay. Yeah. So there's just so much to it. From the diagnostic process has lots of steps, and often you have to kind of go through all of them to even find it for sure. And then there's all the treatment options, and there's all the surgical options, and there's just so many things that I think I can imagine women who are going through this are just swimming in panic, wanting to deal with it right away, and yet overwhelmed from all the options and all the things. So I think having an advocate and having that knowledge that you can ask for the second opinion, you can ask for additional testing, you can, explore all the options. I think just knowing that there isn't just one path to this process is also kind of hopeful. I mean, it certainly can add to the overwhelm because that just adds all the options, but there just isn't one path that everyone has to go down. And then to focus on being the healthiest version of you while going through this, I think that's vital for every condition, whether it's breast
Absolutely.
cancer or, another kind of cancer or heart disease or diabetes or, autoimmune conditions, whatever it is. We do have a lot of control over all of these things and how severe they get and how well you recover from them and how well the treatments work. And so I think all of that is relevant to all conditions, not just breast cancer for sure.
Well, the first thing I think it's important is that it's not necessary to panic. Although it may seem like a medical emergency, unless there is a huge tumor pressing on your heart or something, there is no medical emergency. It took a while for the cancer to develop to the point where it was discovered. And it's okay if it takes a while, a couple of weeks, for you to decide what is the best treatment for you. And the more you individualize your care, the healthier you'll be. The medical philosophy of life is just, do the standard American diet, do the standard American lifestyle. And if there's a problem, take a pill. So as a naturopath, and also for you as an integrative practitioner, our approach is to let's see what we can do to prevent you from having this illness or diagnosis, especially adult onset diabetes. It's totally inflammatory, caused by standard American diet and standard American lifestyle. And the more you separate yourself from that bell curve, the more you get out of that bell curve and just say no to the status quo of what is handed to you on a silver platter through medical world and also the messages we receive from American advertising, the more you say no to the status quo, the healthier you will be.
Yes. Yeah, for sure. The reason why the Hippocratic Oath is first do no harm, well, that applies here too. We have to stop doing harm to our own bodies if we really want to reverse disease, prevent disease, put ourselves in the best place to actually recover from these things, even once we do have them.
Mm-hmm.
Everything you can do to support your immune system, your overall body function, your mitochondrial health, your metabolic health, your gut health, all of these things are going to help your body recover faster and better and with far less side effects and with less medications. So, yeah, I think that's great advice. So, I'd love to know from you, what are some of the mistakes that people are making even before they ever get a diagnosis? What are some of the things? I mean, you mentioned standard American diet and kind of our standard lifestyle that is so common today. That's not just true in America, but really worldwide nowadays. What are some of the mistakes that people are making when it comes to their diet, when it comes to their lifestyle? You mentioned some of the products that people are using, air fresheners and dryer sheets and personal care products. What are some other things that people could start cleaning up now, even before they get a diagnosis, or even if they have a diagnosis?
Well, I think that's really good questions. First of all, I always start with nutrition because how we feed our body, like gives messages on every level. So you need to look at how much processed food you're spending your money on. And one of the things that I think is very interesting to do is go into your pantry and your closet and your kitchen and pull out everything that's in a box or a can and start reading labels. If there are words like glucose, corn syrup, red dye, yellow dye number, XYZ, it doesn't matter what, if there's those kinds of things in there and big words that you don't understand, that is the message that that is not real food. And your people say to me, well, I can't afford to buy organic. And I'm saying, well, how much money did you spend on this cereal, which is sort of like eating cardboard? So you need to begin to look at where you as a consumer are spending your money. That is number one. Luckily, we're going into the nicer weather now, so there's lots of farmers markets, but most people live near a health food store and start deciding, well, I'm only going to buy organic vegetables and see what happens to your health. I'm going to stop bringing in certain things into my home. For me, I know I have a potato chip addiction. I am a potato chip free zone in my house. And if somebody says to you, well, I want to have potato chips, you can say, well, I'm sorry, you can eat them when you're out with your friends, but we can't have that in the house because my health comes first. That's number two. Start standing up for your health. Expect more from yourself and expect more from your family to support your health and well-being, and expect more from your doctors. Take an active participation in your health. That's number three. When you go for a doctor's visit, whether it's for breast cancer or for your annual checkup, you want to be prepared. Ask questions. How's my blood sugar? Oh, it's a little elevated. Do I need to get a continuous glucose monitor? What's happening with my cardiovascular health? How's my cholesterol level? Oh, maybe I need to be referred to a cardiologist for an echocardiogram. Number four, are you moving and exercising and building muscle every day? The amount of research that is going into movement is phenomenal. And in the olden days, when we were farming and we were walking, we lifted bales of hay. We were dealing with all this muscle movement. We had muscles. Nowadays, most of us are sitting and we are not developing muscle. In fact, we are developing more adipose tissue. And adipose tissue is where estrogen likes to hide out. So when you are put on a tamoxifen or a aromatase inhibitor, there's an article I wrote called the plus 5 to 15 pound syndrome. I've had women gain 50 pounds on tamoxifen, which I think is medical, not it's not medically okay that that happened with a woman. So if you're on hormone blocking medication and you spontaneously find that you're gaining weight, this is time to find an integrative practitioner, because this is not the skill set of your oncologist, to help you figure out how many carbs are you eating? What, are you moving? You need to track your food. I have people do a food log for me for a week at time of day and what you're eating. And that way we can see really clearly, oh, at 4 o'clock, every day you're eating cheese and crackers. Now I'm not a big calorie counter, but that's extra fat and extra carbs. And how is your hemoglobin A1C? That's an average of 2 to 3 months of your blood sugar. So there's a lot of information where you can take an active participation. It's available easily for you on the internet to find this out.
Yeah, I think that's so important to get the right labs, to have them analyzed appropriately, to really take a good hard look at all of the things you do have control over. The food you bring into your house, the food you put in your mouth, how often you eat, what time of day you're eating, all of these kinds of things. And then we can layer in, exercise and stress management and sleep and toxin exposures and all these other things that directly contribute to how well your body is recovering, how many insults it's having to recover from, and then, providing it the building blocks that it really needs to be able to manage all of its normal functions appropriately. So I think definitely looking at all of those things. And you mentioned, specific foods and some of that. I'd love to dive in a little bit more on the nutrition side of things. And what are some of the things that you really see people should, outside of the junk foods and the obvious things that we all know we shouldn't be eating, even though most people are still eating them. But if you could just, if money wasn't a factor and you could buy anything at all, what would be like the ideal nutrition strategy for someone to either prevent or who's going through cancer?
Well, there's a lot of, first of all, when you're going through treatment, how you eat is different than when you're done active treatment. But there is a lot of research about with two main forms of nutritional approach. And there's a lot of weird diet things out there. There's like the vegan diet, which I think is horribly unhealthy. There's this cottage cheese diet, which is absurd. Then there is a ketogenic diet and the modified Mediterranean diet. And those two forms of eating have the most positive research. And this is what it's all about. It's about research. It's about science-based protocols. It's not about, well, let's throw in a little bit of this, a little bit of that. I mean, my online program has over 400 references. It's very research-based. It's about taking the best of both worlds, medical oncology and research, science-based integrative care. So from a nutrition standpoint, the modified Mediterranean diet has the most long-term large body of research for cardiovascular and brain health and lower risk of diabetes and cancer. Now, if you have if you have brain cancer, the research is very clear. You need to be on a very clean ketogenic style diet. And there is an amazing amount of research, but breast cancer is not brain cancer. So from where I stand or sit right now, it is all about modified Mediterranean approach to eating. And what does that mean? It means gluten-free. It means very low carb. It means organic as much as possible. It means very, very low sugar, lots of vegetables, lots of healthy fat, and some fruit. Certain fruits you don't want to eat too much because they have a very high glycemic load. And it's also about drinking enough water, having wine occasionally, depending on where you are in your treatment. And it's also very critical that you move and build muscle. It's not just the Mediterranean diet, it's also the Mediterranean lifestyle. Those people who are living, and there's a lot of research about the blue zones. One of the reasons they live so long is they are walking uphill every day. So I make sure I walk up these really killer hills every day. So, I mean, that's what's important.
Yeah, I love that. And I'm with you. I think those are the two styles of eating that I've also seen the most benefit for with, again, cancer, diabetes, heart disease, autoimmune conditions, like you name it. These are really healing metabolic therapies. These really are therapeutic nutritions. They're not fad diets. They're not all the things you might see on social media about, keto and keto snacks and random things that have keto
Keto
labels.
snacks are
This is
not
very good.
healthy. Right. Now, the other reason I recommend this way of eating is because you can really go anywhere and still make healthy choices and have it be easy. And one time I helped a woman who was living in the middle of the country, and like Denny's or Olive Garden was only available to her. And we looked online at the menu and we found like she could have grilled shrimp with a tomato sauce on the side and steamed and sauteed vegetables and a salad. And everybody else was eating all this other stuff. And she was very happy with her grilled shrimp, or she could also have lobster. So it's not like you're eating that kind of food that often, but everything, there's a lot of other unhealthy options there, but we figured out what she could eat that was healthy for her. And it is possible when you're eating a modified Mediterranean approach to go to any restaurant except a pizza joint and get healthy food and not feel deprived. Because if you feel deprived, it doesn't work.
Yeah. Yeah, for sure. Definitely. And there's probably, even if you got really creative, there's probably a way to make a pizza place work. You just would not have the crust, but I don't know. We'd have to do some work on that to figure that out. But I agree with you. You can go anywhere and you can create something or find something on every menu that will work. It's not ideal still because it's probably still got oils that we don't love. Restaurants use a lot
It's
of the
true.
cheapest ingredients. It's certainly mostly not going to be organic, but
No,
it's still better than a random box full of
it's still
chemicals.
it's still better than eating lasagna.
Exactly. Yes. Yes. I love that. And I would love to dive in a little bit based on the hundreds of studies that you've referenced in your program. Is it really just about the glucose, or what is it specific about those nutrition plans that are so healing, that are so beneficial for especially a cancering process, but really any of the chronic diseases?
Well, cancer loves sugar. In 1918, there was a German scientist by the name of Otto Warburg who discovered what is now known as the Warburg effect, and he won the Nobel Medical Peace Prize for that in 1924. And what he discovered is that cancer, given a choice for its two main pathways of either oxygen or sugar, glucose, it always chooses glucose, even though it has to work twice as hard to get that energy, and it gets much less ATP or gas for the cancer gas tank, so to speak. So the lower you feed your body foods that are easily transferred into glucose in your bloodstream, the healthier you are. The goal is to keep that cancer gas tank on as low or empty as possible. And one of the ways of doing that is through intermittent fasting, in which you don't eat. For the physiological impact of intermittent fasting happens between hour 14 to 16. So you finish eating, for example, like at 6 or 7 o'clock at night, you go to that when you don't snack at night. That's the thing that a lot of people do. They watch television, they eat another meal, and then they go to bed and they wake up and eat breakfast right away. So you finish eating dinner, you drink herb tea, and then when you wake up, if you go to finish eating dinner at 7 p.m. to 7 a.m., that's 12 hours. So you don't start eating again until 9 a.m. It's not that hard. Um, and you do that a couple times a week. And what that does is it creates chaos for cancer cells. Cancer cells don't like chaos. They want to know they're being fed all the time at a certain time. So if you alternate days that you intermittent fast, the cancer cells get hungry. And then the first thing you start eating and feeding them is some like organic matcha green tea, which has a lot of anti-cancer agents. And the healthy cells go into recovery and they're protected. So that's one of the tricks of going to chemo or radiation. You fast before you have your treatment. So the healthy cells are protected and the cancer cells get the treatment, uptake it at a higher rate. So yeah, let's just start with that.
Yeah, love that. I think fasting is such a powerful thing when done correctly. And of course, it's not just about the period of time when you're not eating, but that what you break the fast with and what you eat when you are eating critically matters. That matters more than how long your fast really is, because you can undo all the benefits and cause a whole bunch of damage if you break your fast with junk food or high sugar cereals or, whatever that looks like. So I think fasting can be such a powerful thing when done correctly and when paired with a good quality, especially lower carbohydrate style of eating, so that you're really bringing down those blood sugars and bringing down your insulin level, because insulin is also a big growth factor. It's driving
It is.
growth of the tumor. So for sure, we want to keep that all low as well.
In fact, there's a marker called IGF-1 and IGF-2, insulin growth factor 1 and 2. And those are markers about how much your glucose, your insulin is driving cancer. And if it's going up and you have an elevated hemoglobin A1C and your leptin and your C-peptide are both elevated, that's an indication that what's happening in your body is potentially driving cancer. So that's where you have the clear benefit of knowing what tests to do and then getting the feedback and making changes, not just with how you're eating, but also with certain supplements.
Yeah. Yeah. I love that. So let's talk a little bit more about the fasting piece specifically. You mentioned fasting before going in for the treatment is really helpful. What does that look like? And then do they also extend after the treatment is
Sure.
finished?
So first of all, if you're very slim and you're developing something called cancer-related cachexia, this is not appropriate for you. I just want to make that as a caveat. A lot of women lose a lot of weight during cancer treatment, and that is very dangerous. And you need to be working not just with your oncologist, but integrative practitioners have a lot of options to help you gain weight in a healthy way. We have to get your appetite back, first of all. So if you're not in that category, then what I recommend before treatment, whether it's a chemotherapy infusion or radiation, is you fast. And if you've never fasted before and all you can do is 8 or 10 or 12 hours, that's better than nothing. And then you go in for treatment. And when you come back, you drink lots of herbal tea and maybe a smoothie, and then maybe some Beeler's broth or broth. And then you eat the next day, food. So you don't go from having your treatment to coming home and eating like a bowl of cereal or something like that.
Yeah, that makes sense. So fasting beforehand and then introducing slowly with some broth, maybe smoothie, something easy to digest that's not really heavy on the system, and then going back into eating. But again, all
Following
healthy
day.
foods, all ideal, organic, good stuff. Yeah, that makes sense. How long, if you are comfortable with fasting and you've got the body type for it, you've got the extra body fat, you can sustain a fast, what would be kind of the ideal length of fast before a treatment?
I'd say 14 hours,
Okay.
14 to 16 hours.
Okay, good. So it doesn't need to be any like 2 day, 3 day fast. It doesn't have to be
No, I'm
anything
not into,
long.
no. I mean, if you're
Okay.
starting to do that, that's a whole different physiological impact. And I don't think fasting for 2 or 3 days and then going into treatment is going to serve you. Actually, you could get very sick.
Okay. Good to know. Good to know. Because I could see people going, well, a little bit's good. So a lot is even better, and maybe pushing it too far and causing extra problems. So that's good to know that just the regular intermittent fast is plenty.
Yeah, absolutely. 100%. That's
That's
what the research has shown.
okay. Good to know. Okay, so then from other lifestyle factors, you've mentioned the toxins and being able to exercise and, keeping up our muscle mass. What are some of the other things that people should pay attention to, maybe stop doing or start doing when it comes to lifestyle factors?
Well, let's talk about what it takes to develop muscle mass. I mean, it is not necessarily easy, especially if you're an older woman and you're deconditioned and you've never exercised before. And you watch these videos of these young people who look great, and you go and you exercise and you hurt yourself. Uh, you can't go from 0 to 100 in a day. So this is where I have something which I call the 5-minute approach. The first time you start to exercise, whether it be walking or using a treadmill you have in your basement or whatever, a stationary bike, just do 5 minutes. And then you're going to notice your mind going, well, it's only 5 minutes. It's not a big deal. Or that was really hard. I hated it. I'm not going to do it again. So you need to watch what happens in your mindset after you exercise the first time if you haven't been doing it. So I had a woman who had what I call the couch potato syndrome. Now, the couch potato syndrome is not a DSM diagnostic code, but it is a code a diagnosis that I apply. And it has to do with the fact that the woman was so fatigued and so inflamed after treatment and with her medication that she couldn't get off the couch. She was having horrible pain, and it was very difficult for her to walk. So, how do you take somebody from that place and then gradually reduce the inflammation and the pain so they can then start to even move for 5 minutes? That can take several months, and it's a slow and steady process. We start with changing how she's eating. We start with the smoothie. We start with putting in a few supplements and mindset work. And then after a few months, most women are ready to start moving. So this happened to this one woman. It's a true story. And she started with going on the treadmill for 5 minutes. And then she emailed me and she said, well, it's only 5 minutes. It doesn't matter. And I said, well, that's great. Let's do 10 minutes the next day. And so after 10 minutes, she emailed me and said, that was a lot. I said, fine, stay at 10 minutes for a week. And then that's how we gradually built up. And she was able to do 20, 40 minutes on her treadmill with increased resistance. And then she said to me, I love to ride bikes. So I said, great. I hate to ride bikes. If you asked me to ride a bike, it would never happen. So this is where it's really important to find a form of exercise that you like, because we're all different. So it was her birthday. She went to the local bike store with her husband and her 14-year-old son. And I said, get a really good bike that you'll be able to up level yourself to, not just a piece of junk. And she got a really good bike, and the whole family started to bike ride on the weekends. This is where the ripple effect of you deciding you're going to get your health better, improve your health, impacts the whole family, because her husband started losing weight. He started developing muscle. Her 14-year-old son got muscle and his self-esteem improved. She developed muscle, and they started out with 5 miles on a weekend. And then that turned into 15 and 25 and 50. And a year later, she completed a bike ride from San Francisco to Los Angeles on Highway 1, which is very windy and uphill, a lot of it, with a group. 25 miles a day, 4 days in a row to raise money for breast cancer. So that's how you go from 5 minutes to being able to really do what you want in a way that matches who you are. So the 5-minute approach is really what it's about. So you need to find something that you like to do. Power walking, Pilates, swimming, biking, tennis. But you also need to lift weights. I think that we need either a Zoom meeting with a professional or a local gym. It's hard to know as an older person what is appropriate for you to do. You don't start lifting 25 pounds, you'll hurt yourself. You don't even need to lift 25 pounds. You can develop muscle with 5 pounds, or 8 pounds. So you need to start slow, and you need to have someone help you.
Yeah, I love that. I think that's such great advice. And the key to finding what you like, what you'll actually do, is so vital. If you hate it, you're never going to do it. You're going to find every excuse in the book, and you're going to be miserable the whole time. And even if you stick with it when you hate it, you're not getting nearly the benefit out of it when you hate it.
You can't do something that you hate every day. It has to be
Yeah.
something that you really enjoy.
Yes, yes. So try out a bunch of different modalities. Stick with it for a little bit of time. There were things I used to hate doing, and now I love them. So I think be willing to just kind of play with it and find different things and find different structures and locations and times of day and whatever that looks like for you, but find something that you don't hate, for sure. I'd love to pivot a little bit and talk some about some alternative therapies, or, I mean, they're considered alternative, but they're actually pretty mainstream. But things like, you're an acupuncturist. What about hyperbaric oxygen or sauna or cold plunges, or like all of these kind of biohacking things that we now hear about? Are there benefits or risks to any of those things while going through this process?
I think I am an acupuncturist, and I think there has been a lot of research how acupuncture reduces chemotherapy-induced nausea. So absolutely. Also, so when you're in active treatment, getting chemo or radiation, acupuncture can not only reduce the nausea, it can keep your energy up, it can reduce neuropathy. There's a lot that acupuncture can do during and after treatment. Hyperbaric oxygen, I think you need to do it when it's appropriate. I would not necessarily recommend doing it in the middle of treatment. Cold plunges are a form of hydrotherapy. Hydrotherapy, you need to do the cold and then you need to go into the sauna afterwards. You have to do it if you're strong enough. You can't do it if you're weak and depleted. So if you've finished active treatment and you're really depleted, now is not the time to be doing hot sauna and cold plunges. And you got, there are ways of doing hydrotherapy with the hot and the cold without putting your whole body in a bucket full of ice water, which to me sounds horribly unattractive. Even if you're like hot from the sauna. So we studied all about the benefits of hydrotherapy in naturopathic medical school, and it is really an important aspect of biohacking because it brings white blood cells into your system. It decreases the lymphatic swelling. And helps you recover your health, but you have to have a certain amount of essential energy and strength to be able to tolerate that. So if you're very depleted, do not do that. So you need to be working with a practitioner who understands who you are, where your energy is, and where you are in your treatments. And is this appropriate for you?
Yeah. Yeah, because all those things are stressors, which is why they are helpful because that's making you stronger. Just like when you lift weights, your muscles tear a little bit and they come back stronger. That the stressor is a good thing, but if you're already depleted, you can't handle any more stress. So I think that's good advice and a practical way to look at things because we all want to throw all the things at it, but sometimes that actually makes it worse, and
Yeah.
that's not going to help you any.
I'm not into throwing the kitchen sink.
Yeah.
You need to be very methodological and calm and know when to do what. Creating a supplement protocol is not about, oh, here's 15 things that work. Let's just give them all to you at once. It doesn't work like that.
Yeah. Oh, this has been so amazing. And we could talk for days because obviously this is a massive topic. But I'd love to just give you the opportunity to say any final words that you'd love to share with the audience, anything that would inspire them or uplift them or give them, hope for their future.
Just as there isn't one thing that went into contributing breast cancer, there isn't one thing that's going to reduce your risk of recurrence. And I think it's important to do what you can when you can to keep yourself as healthy as possible. And then a lot of women, when they're initially diagnosed, they go, well, I'm just going to get through it. And then you put all of your emotions on the back burner. And then after it's over, all of a sudden you're very overwhelmed. So that's where I come in. That's where the life group coaching is important. You do what you can when you can do it. And listen to your intuition and seek out an integrative practitioner because we have a lot to offer you in support of what your medical oncologist is providing you.
Yeah, I think that's great advice. And, it really does take a team to get through these things. We need both conventional and alternative approaches. We need integrative medicine that can bring all of these things together. We need coaches. We need supportive family members. We need supportive friends. We need so many things. So I think that was a great way to wrap this up. Thank you so much for sharing your stories, your insights, all of your knowledge, and the information about your programs. If people are interested in learning more about you, where would be the best place to send them?
Carol Lourie. My last name is spelled Lourie.com. There's a contact me page there. I respond to every email I receive. And thank you so much for having me.
Absolutely. We will definitely link up your information in the show notes. So it'll be really easy for people to just click on and get over there to your site and learn about either working directly with you or in your online program as well. So thank you so much for sharing everything today. To everyone else out there, be well and vibrant. We'll catch you again on future episodes.